Hey, what's going on, everyone? This is Drew back here at VCS. I'm joined by Dr. Macias from Marina Del Rey, right?
Correct.
Plastic surgeon.
Yep.
Welcome. Thanks for joining us.
Thank you for having me.
How's the show going so far?
It's fantastic. It's a fantastic show. It's my first time, actually, but I'm really excited to be here.
Okay, cool. What other shows have you attended in plastic surgery where you can compare it to this one? And
Well, there's ASPS and ASAPS, which are the two bigger conferences.
Were you at ASAPS a few weeks ago?
I was at ASAPS
Gotcha.
in San Diego. It was a fantastic conference. Board-certified plastic surgeons.
Sweet.
Which is a little different from this conference, which makes this conference the attraction that it is that this one's multi-specialty with the dermatologists and the facial plastic surgeons coming together and talking about all that stuff together. So
Sure.
That's why I wanted to come to this one.
Yeah, I love it. That's what, so far, everybody I've been talking to, they're saying the collaboration, the multi-specialty is just something you don't get at other shows. So
Yeah, there's different approaches to things that the other specialties may have, and to share these is amazing to just further promote the specialty and also to just advance the specialties.
Yeah, absolutely. Well, cool. Let's shift gears here a little bit. I want to get to know you a little more. We can show your patients some stuff they may not know about you already. So
all right.
What's your favorite color?
My favorite color is red.
Nice. Are you a sports fan?
I can be, depending on if my team's doing well or not.
What's your team?
Who's
your team?
So it used to be the Raiders, but they're moving to Las Vegas.
Okay.
It's kind of funny. We're in Vegas now, so they're not the team they're not my team anymore.
Only when you're in Vegas.
Yeah, in LA, we lost our football team, so then I have to go back to where I was born, which was Chicago.
You lost your football team. Now you got two, though, with the Rams.
The
it's
Rams,
not the same.
The Rams were never. I don't know. I never liked them when they were in LA back in the day. And
now
that they're back, I don't like them. So I don't know. I'm gonna have to go back to where I was born in Chicago, to the Bears.
Okay, there you go.
Stay a Bears fan.
Well, good luck with that.
I know. And I'm a Lakers fan because I'm from LA and they're not doing so well.
They'll figure it out.
And the
I think they're gonna figure it out.
The Dodgers keep getting there, but not.
Yeah, they get right there. Just when you think Kershaw and they're all gonna take it, they just kind of doesn't work out. All right, cool. What were you like in high school?
What was I like in high school? Kind of a nerd, I guess. Except that I was in football, but I also I was
kind of well balanced.
I tried to be, but I was pretty much a nerd.
Hey, to get to where a lot of that's what most of the doctors say is, I was actually pretty studious and I was a nerd. But to get to where you guys have to go, you have to be serious about your education and learning. So.
But I was trying to fight it pretty hard with being in football and then joining the Marine Corps. And
you were in the Marines?
Yeah, so I joined the Marines after high school.
Beautiful.
And I was enlisted Marines. And then
thank you for your service.
You're welcome.
Yeah.
And then I went to UC. I went from the Marines to UCLA. I used the GI Bill to go to college.
Oh, nice.
That's how it all.
So how long were you in the Marines for? Did you have to go to Iraq at all?
No,
or?
I was actually my age. I was right between the two wars.
Wow.
During the Clinton years, where there really wasn't too much going on.
You look young. That's why I asked.
Yeah.
But I guess if it was Iraq, you'd probably be like late 20s, early 30s.
Yeah. So
right?
I was right between the two. I joined right after the first Desert Storm.
Okay.
And in '92. So It's been a little while.
Yeah. Okay. Right on. Good stuff. What was the last thing you watched on TV?
What was the last thing I watched on TV? Oh, Black Mirror.
Which one's that?
It's a really cool show on Netflix.
Okay.
It's from England. It's about how technology is going to mess up our lives, essentially.
And it's a actual mini. It's
a mini series,
okay.
But each episode's completely different.
Oh.
So it's a brand new cast, brand new sort of plot. One of my favorite ones was one where people give each other ratings, 4 or 5 star ratings, 2-star ratings, just based on interaction. So right now we're doing pretty well. I'd take out my iPhone, I'd give you a 5-star, and it would go bloop. And then you didn't like me or whatever, and you'd give me one or something. And so then based on those ratings, this is what your social status is now.
That is
not
interesting.
Based on money, not based on
that is
just
interesting.
on your star likings that everyone gives everyone based on their
that's fascinating.
Every interaction throughout a day.
What's so fascinating about it is that I can actually see someone trying to do that.
Yeah.
You know?
Yeah.
Wow,
so
Black Mirror?
It's Black Mirror.
One thing I'm learning, too, is that nobody watches TV anymore. It's only Netflix.
Yeah. Well, it's easy because you don't have to schedule it around there. And then you can binge.
Yeah, exactly. So did you watch Stranger Things at all?
No, I haven't watched that one.
Oh, it's a good one. What about the OA?
No.
You got to watch that one, too.
We got two we got to watch.
A lot of good ones. Watch those. Yeah. They're very similar. Okay, cool. Why did you get into plastic surgery?
When I was a general surgery resident, I got into surgery because I liked surgery.
Okay.
And then when I was a general surgery resident, I was considering cardiothoracic surgery. I really love doing hearts and
Oh,
heart
wow.
transplant.
Oh, wow.
And plastic surgery, and I like them both equally. And I had a mentor who said, well, when you're 65 years old, are you going to be wanting to go get a heart in the middle of the night and this and that? And he's all, you may want to consider lifestyle. And when you're 30-something, you're not thinking lifestyle. You think you're going to be 30 for the rest of your life.
Sure.
And I like them both equally as much. And it's because I had two mentors that were just phenomenal surgeons in general surgery residency. And they were a CT surgeon, a cardiothoracic surgeon, and a plastic surgeon. So I was like, I want to be just as awesome as they are, and they're technically just amazing surgeons. So I really like those specialties. And plastic surgery allowed me to operate from head to toe. Like there wasn't a body part that we own, which is nice about plastic, but it's also our downfall because then other specialties start picking things off of us.
Being like specialists?
Yeah,
kinda?
like the facial plastic surgeons will say that, well, we just do face plastic surgery, and they're taking that from us, and then breast surgeons are trying to do breast augmentations now and becomes just a breast surgeon all around.
Sure.
So we don't own a body part, which is cool, and it's not, because then we have to continuously innovate in order to keep our specialty relevant.
Right. It makes me wonder that if as it becomes more competitive with plastic surgery, there become more and more of them, that maybe like the specialization is almost kind of where it goes. Because I feel like in other industries that happens naturally. You get the specialist after it becomes, well, how do I differentiate myself?
Exactly, and that's what a lot of plastic surgeons say. That they just do breast, or they'll just do rhinoplasty, they'll just do facelift, or things like that, because they want to differentiate themselves in the market.
Yeah, makes sense. Okay, cool. All right, last question. Actually, second to last question. What do you love most about your job?
Wow. One thing that I love the most, I like.
Could be everything that you love about it.
I mean, I love being in the operating room. I love the sort of artistic side of it. That it isn't all just like a recipe or a cookbook. It's about how things look on a certain person and how it fits within their body, and how to make it look natural is really important to me. And that is. That is difficult in some people. So making a natural result that keeps with the rest of their body, I think is the most challenging and most fun part of it.
Cool.
So that patients don't walk around looking odd, looking done. That they're happy with their result and they can fit in with society.
Yeah. Cool. I like it. All right. Last question. If you can be any kind of animal, what would it be? Spirit animal.
What animal would I be? That's a great question. Probably a dog, because we treat our dogs so darn well.
Absolutely.
I think I would be Django, our dog Django, or Coco too. She's a little crazy.
What kind of dogs are they?
So we have my girlfriend Jackie and I have two dogs, Yorkshire Terriers. My sister actually gave them to us.
Beautiful.
Gave me Django, and we're taking care of Coco. And Django's 5-pound Yorkshire Terrier, and Coco's 2 pounds 11 ounces.
Wow.
So she's
Peanuts.
she's a tiny little thing.
Cool. So a dog. Awesome. I like it. All right. Well, thanks for joining us. I appreciate it. It was good to get to know you.
Thanks so much for having me.
Have a good show.